Are you suffering from any type of shoulder pain, particularly trying to lift the arm up overhead or throwing an object? If so, you're probably suffering from a very common shoulder injury, which is rotator cuff injury. And the two muscles that are most commonly injured would be the supraspinatus as number one and the infraspinatus as number two. Now these muscles, their primary goal is to stabilize the shoulder during movement. So if you're having any type of pain during shoulder movements, you're going to want to get these checked out. So what if you're unsure if you have this type of injury? Well, here's a couple tests that you can do at home that might give you the answer. The first one, we're going to take a look at the supraspinatus. And to test this one, we're going to do what's called the 0-degree abduction test. Abduction meaning going away from midline. So for this test, what you want to do is you can go up to a wall, or you can just use your arm and use this as resistance and keep your arm at your side and then try to abduct the arm that direction, outward. If that causes any type of pain, it's likely you have some sort of supraspinatus tendinopathy or tendinitis. The other test we want to do is the drop arm test. Now for this one, you're going to want to lift your arm up so it's in line with the shoulder, and then you're just going to drop it. If you're unable to catch your arm because of the pain, or if you're even too afraid to let go of your arm because you know there's going to be pain, that's indicative that you have some sort of supraspinatus injury. Now let's talk about the infraspinatus a little bit. So we can also do the same 0-degree test, but we're going to do external rotation because the primary movement is external rotation for this muscle. So keep the elbow in, use your arm as resistance or a wall, and then you're going to do the same thing. Just try to externally rotate the shoulder, just like that. If this is causing you pain with resistance, it's likely that you're having some sort of infraspinatus or maybe even teres minor, tendinitis, or tendinopathy. The other test that we want to do is you can come up to a wall and perform what's called a wall angel. If bringing your arms back, if you start having that sort of pain, that is also indicative that you're having some sort of problems with that infraspinatus muscle. So now that we've discovered that we have injury within one of these two muscles, first what we want to do is we want to work on range of motion of the shoulder. Oftentimes what I see is if these muscles are injured, the other major rotator cuff muscle known as the subscapularis gets overpowered and starts to roll the shoulder in. So to release the musculature of the subscapularis so you have better range of motion in the shoulder, what you can do at home is simply grab a broom and then take that and you're going to go underneath the armpit and we're going to perform a myofascial release. And you want to go try to press against the anterior, that front edge of the scapula. And what you're looking for is just tender areas and just trying to massage it gently, okay? Once you feel that muscle's release, we can then start working on passive range of motion. If you're having any type of problems with any type of shoulder movements, we want to start with some passive range of motion in order to train the nervous system for that movement. So to build passive range of motion in the supraspinatus muscle, you're going to take the affected arm and grab the broom underhand. You're going to take the other arm, and this arm is going to perform all the work. All I'm doing is working my arm into abduction right there, okay? Because that supraspinatus initiates abduction. Once we can do this pain-free, we can start exercising. For the infraspinatus, it's the same kind of thing, but you're going to keep the elbow in, and we're going to do passive external range of motion, just like that. Okay. Once those movements are completely pain-free, then we're going to start working on some isometric. All right, now that we've done passive range of motion, we're now going to begin the isometrics. So for this, we can do that test that we did at the beginning. What you're going to do is resist your arm trying to abduct. You're going to want to hold this for about 30 seconds and repeat it 3 to 5 times. What you're looking for is an analgesic effect. You want your pain to start decreasing the more and more you do this. And for the infraspinatus, for the isometrics, again, same thing. We're going to do that 0-degree external rotation test. So you're just going to stand here, use your arm to resist, and then again, I'm trying to externally rotate the shoulder. Hold this for about 30 seconds. Do it about 2 to 5 sets until there's no pain. When there's no pain with that, then we're going to start working on our eccentrics. Now to build eccentric strength within these muscles, you're going to need a little bit of resistance. So I have a band here. You can also use dumbbells and other things as well. But let's demonstrate with this with the band. So to train that supraspinatus, and this is really good for that tendinitis especially, you're going to want to use the opposite leg and have your arm slightly adducted to begin. Then what you're going to do is you're going to try to abduct the shoulder, and then I want you to focus on going slowly on the way down for the eccentric portion of this contraction. This is going to increase muscle hypertrophy so the muscle grows, so we don't have any type of atrophy, and so the muscle is functioning properly. For the infraspinatus, again, that's the external rotator of the shoulder. We're going to do this exercise. You're going to grab the bands, and you're just going to keep the elbows in and bring the wrist out, just like that. You should feel your shoulder blades coming together a little bit too, and get some rhomboid activation with that as well. Again, focus on coming back slowly on the eccentric portion because that's going to help train the muscle so it grows, gets stronger, and reduces those side effects of pain. Okay, now that we've done the passive range of motion, we've released our subscapularis muscle, we've done some eccentric exercises, so now we're pain-free, the muscle feels strong, and it feels stable. So now what we want to do is to warm up our shoulder to make sure we avoid injury in the future. So anytime you're performing any sort of resistance training, sports that involve the upper body that could possibly injure the shoulder, I want you to do these exercises. These are called ITWYs. Now, first stand in an athletic position so you have good support in the lumbar spine and brace your core. Then what you want to do is externally rotate the shoulder. That's going to activate that infraspinatus. And then you're going to start making a letter I. Okay? Do that for about 10 reps. Then you're going to do the letter T. About 10 reps of that. The letter W. And the letter Y. This exercise is great because it's not only going to strengthen and warm up the shoulder joint, but it's really going to maintain and even increase that range of motion. So if you're having any type of shoulder pain, make sure to get it checked out. And if it is some sort of rotator cuff tear, try these exercises and see if that helps. If you like this information, please like and subscribe for more information, health and wellness.